State association, not causation, and RWE. Precise English phrases. Real-world evidence, or RWE, can be incredibly informative, but it usually shows associations rather than proven cause and effect. Observational studies often reveal patterns, like a treatment being linked to better outcomes, but these patterns do not automatically mean the treatment caused those outcomes. When language is ambiguous, clinicians, policymakers, and patients can draw the wrong conclusions, which may lead to inappropriate care, misguided policy, or false hope. Using clear, cautious wording preserves scientific credibility and, most importantly, helps protect patient safety by preventing premature or incorrect action based on incomplete evidence. A frequent error is writing as if observational findings prove causation, saying X causes Y when the data only show a relationship. Equally risky is using causal verbs like lead to or resulted in, without study designs that support a causal claim. Headlines and conclusions are especially tempting places to overstate results. Sensational language can mislead readers who don't see the methods. Keep conclusions proportional to the evidence, and avoid turning tentative observations into definitive claims that the study cannot support. When you want to describe a non-causal finding, choose phrases that clearly signal association. Use associated with or linked to indicate an observed relationship without implying directionality or mechanism. If you're reporting a statistical measure, correlated with highlights that two variables change together, but doesn't claim one causes the other. For neutral, transparent wording, say, an observed relationship between, which explicitly emphasizes non-causality and invites readers to consider alternative explanations like confounding or bias. Avoid definitive causal words such as caused, led to, or produced, unless your study uses a design that supports causal inference, like a randomized trial. If you must use causal language, for example, when discussing plausible mechanisms, attach qualifiers like may, could, or potentially to reflect uncertainty. Silence about uncertainty is worse than careful wording. An unqualified claim implies confidence you don't have. Prefer active qualifiers that explicitly state limitations, rather than leaving readers to guess how strong the evidence really is. A short, clear disclaimer helps set expectations. This observational study shows association, not causation. Also add key design limitations, for example, non-randomized, residual confounding possible. These concise notes alert readers to important methodological caveats. When discussing implications, avoid implying causality. Use phrases like, findings suggest further study, or may warrant additional investigation. These contextual statements preserve nuance while still communicating clinical relevance and the need for stronger evidence. Craft one clear sentence that states the observed association, notes the study design, and ends with an appropriate implication. Start with the main result. X was associated with lower Y. Follow with a limitation clause in this non-randomized cohort. Finish by stating what should come next. Further randomized studies are needed. This structure keeps your conclusion honest and useful. It reports what you found, how confident you can be, and what the logical next steps are for research or clinical practice. Before you finalize a manuscript or slide, run a quick checklist. Replace causal verbs with association terms where appropriate, swap reduced for was associated with lower if causality isn't established. Add a one-sentence limitation or disclaimer in both the abstract and the conclusion so readers see caveats up front. Finally, check headlines, captions, and social copy for causal overreach. Those short phrases often strip away nuance. A brief edit pass focused on language will markedly reduce misinterpretation. Use precise association language to avoid overclaiming. Phrases like associated with, linked to, or correlated with signal appropriate caution. Always include the study design and the possibility of confounding, so readers understand limits to inference. For example, non-randomized, residual confounding possible. Finally, recommend clear next steps, such as replication or randomized trials, to show how knowledge can advance. Careful wording protects credibility and patient safety while guiding better decisions about follow-up research.